Hello, welcome to our group presentation where we will be analyzing the Mutiny case study. Before we analyze this case, I'll go ahead and provide you with a brief overview of what occurred. Presented by Dr. Paul Greiner, this case covers the experiences that he and his coworkers had with their chief of medicine at the Air Force hospital at which they worked. During their first year as residents, specializing in internal medicine, Dr. Greiner and his coworkers became very concerned with the behaviors and care presented by their chief of medicine. He displayed extreme laziness, a lack of skills, and dishonesty, all of which threatened patient outcomes and safety. One shift, Dr. Greiner and the other residents chose to report him to the hospital commander. So after weeks of documentation, they presented their case. And while the hospital commander was receptive, they didn't hear anything regarding the matter until 2 months later, when it was announced that their chief of medicine would be transferred to a smaller hospital. Dr. Greiner and his coworkers were pleased that they would no longer be working with him, but were concerned that this new hospital would be facing similar issues.
So this case really connected to teamwork and leadership, and throughout this whole semester, this class really put an emphasis on that. So as we learned, a physician leader is important in a healthcare team because strong leadership leads to strong patient care and positive outcomes. In this case study of Mutiny, with the chief of medicine, he did not portray this quality of leadership because there was a lot of poor patient care, unscheduled absences, and a lack of professionalism. And mutiny in this case scenario was needed.
So as mentioned, leaders should inspire action, but oftentimes that is not the case. Discussion question 3 asks if a nurse would feel safe reporting a physician and vice versa. Due to the hierarchy established in a hospital setting, I don't believe that a nurse would feel safe reporting a physician who is superior to her or them due to fear of retribution. They may think that they won't be taken seriously. They may be worried of being ostracized by coworkers who support that physician, or they may even be concerned about losing their job. If it were the other way around, I don't think the physician would even consider these consequences.
So for the criticism for this case, we think that there are some great things that this team did, and there are some spots where this team should have taken further action. So things that went well, these physicians were able to band together and report when they saw something going wrong and repeated behavior by their chief. They were able to support each other in this stressful time and also voice their concerns successfully. Along with that, they were able to document their chief's behavior and have a solid record of what was going on in terms of patient care, patient outcomes, and his irregular absences in his schedule. And this team was also able to have a new chief appointed, which ended up being very beneficial to their education, where they had someone as a resource to look up to and learn from in their first year of residency. So this leads us to case question 2, which is, if you're a student, how does this impact your ability to feel safe when reporting an unsafe act? And it is very nerve-wracking as a student to report someone, especially a superior to you. As a student, you are at kind of like a level where you're learning. So there is a similar fear as like a nurse may feel, that you might not be taken seriously and that there are potential repercussions. Repercussions could include not only like receiving a poor grade, but also like receiving like a bad reputation as a student, along with like, potential recommendations not being favorable for you as well. Also, superiors serve as role models. So, being able to voice your concerns is very nerve-wracking because you're expected to look up to them. So things that could have been done in this case, since their chief was just transferred to a different hospital instead of his license being removed, more should have been done. So this team could have reached out to their hospital commander that they initially reported him to and say that they thought this decision wasn't enough since he was still able to see patients, and since because of that, patient safety was still at risk. They also could have gone above their hospital commander to that level of administration and brought their documentation that had already been recorded to them as well. They also could have reached out to the hospital that this chief was transferred to and voiced their concerns of what the experience they had with him. This would save this team a lot of time as well, and also hopefully not have negative outcomes as they did. Another thing this team could have done is report them to the Board of Medicine. This would have hopefully either suspended or taken away his license. So in the meantime, while they were sorting this out, he wouldn't be putting patients in unsafe situations. And making sure that all those environments were positive.
So this relates to case question number 1, which is, under what circumstances would you feel justified, or when is it appropriate in reporting your superior for providing unsafe care? So these are just some reasons we listed that it would be appropriate to go ahead and report your superior. So patient safety concerns. So for example, a physician or nurse is administering the wrong medication. If you notice this in a healthcare setting, you would want to go ahead and report the physician or the nurse, because this affects the patient. Violation of protocols and policies. So a superior is continuously violating protocols, policies, or procedures that are put into place for patient safety and quality of care. And I want to note that those policies and protocols are there for a reason. So it would be appropriate to go ahead and report your superior. And then the last one that we mentioned is evidence of misconduct. So this is concrete evidence of a superior engaging in unethical behavior. So for example, fraud, abuse, or any other form of misconduct that compromises patient care. And I have a personal example of this. So I used to work at a hospice here in Gainesville, and I was just a CNA, but my coworker, which was another CNA, noticed that a nurse was verbally abusing a patient that was there, and the patients are a lot older, and that is very common. I don't really know the outcome of the situation, because I had to leave that work environment because it was not positive. There was no team collaboration, and yeah.
So some alternative solutions that could be provided, or the group of individuals that were in this case report could have done as well. For the first one would be an installation of a safety review board. Due to the fact that the chief was transferred over, the group of physicians that did report the chief could have promoted and petitioned for a board, which according to Goschel and their colleagues is a group of unbiased individuals that hold the interests solely of the stakeholders and the safety of the individuals that are part of that situation as well. In this case, it's the patients, and the stakeholders would be the community themselves. By having that non-biased group of people, CEOs, CFOs, and even chief medical officers as well, even the chief here in this situation, they wouldn't be able to escape with an easy way around, and they would also have the appropriate punishments be inflicted upon them that due to their unsafe practices. Also, having that channel of review could also be beneficial, because more safety practices could be analyzed then. By having those safety practices be analyzed, you have less troubles that could be incurred. On top of that, with more dedication towards having proper instruction being taught to residents and medical staff, along with proper safety and emergency procedures that should be done whenever certain situations arise. In this case, because of the fact that the hospital commander, did allow the chief to be transferred over, proper reporting for initiating to medical board. In this matter, by reporting to the medical board, all hospitals would be aware of that situation, what happened, and they then can have a determination of whether or not they want those unsafe practices to continue in their hospital. Furthermore, by having, again, that review board for safety, this can determine whether or not the doctor should be allowed to keep his medical license or not, or what should be the appropriate repercussions in this case. And finally, installing these areas of confidentiality and unbiased review, we already have then the lossage of ostracization that could occur, along with allowing individuals to feel confident enough to provide those safe reporting for them, so that way the hospital can have the beneficial improvement that it should need. So this brings along case questions 4 and 5. Number 4 being like any situations that I would personally stay quiet about if I were to see a superior providing unsafe care. And question number 5, if I had any personal experiences with bad leadership. These both coincide with my time in the ER, where I saw a nurse taking very bad care of a patient who actually later on did die. No one had reported it when it first had initiated, and this caused a more disastrous case, and it turned into a lawsuit. I chose not to report it, and it was my own fault not to do so, because of the fact that I was afraid for my own job, that if I did not report it, I would potentially have gotten fired, and it would lead to more troubles than I thought was worth for myself. And I realized it was the wrong thing to do as well. And unfortunately, my leaders also agreed with me, which was very bad because of the fact that they should have been promoting the safe reporting where I should have reported right off the bat rather than letting this poor woman pass away in bleeding in the lobby area of an emergency room rather than being taken care of immediately. And that's the end of our presentation. Thank you so much.